the subtle importance of starting your client in a face-up or a sideline position versus a prone or face-down position. One of the biggest things that I see when it comes to typical massage therapy and sometimes chiropractic care is starting your client or your patient face down. Now, while you're doing these techniques and they may need to be in a prone position, that's one thing. But when we take into consideration with SRT how we intentionally work with and focus on the nervous system, the first and foremost focus that we have is going to be how the client feels. So if there is a backstory or a background of emotional, mental, physical abuse, of trauma, of any of those wonderful traumatic experiences that may cause somebody to be on edge, consciously or subconsciously, it's very, very important that they can build a rapport, or that you can build a rapport with them first and foremost. So even though we may want to do some prone techniques, we may want to work on the back or the hamstrings or the glutes from a prone position, it's very important to understand that we are trying to establish rapport and we're trying to download new sensory input into the client's system. So when we start them supine, face up, or side lying, it gives them the ability to watch what we're doing. It gives us the ability to have a one-on-one conversation, make eye contact, be able to read the facial expressions, be able to educate them on the approach that we're taking, how soft versus aggressive affects the body, why soft and slow is very important as compared to fast or aggressive. And so it's important to understand that these are the subtle pieces that make a huge difference in terms of their nervous system letting go. And when their nervous system lets go, their muscular system will let go. And then that will allow us to guide their body into further ranges of motion. So it's imperative to keep that in the forefront of your mind when working with clients, especially if you're a guy and you're working with females. Unfortunately, in today's day and age, there are a lot of traumas that females have gone through, whether it's childhood, teenage years, or adulthood. And so starting somebody face down can be a very triggering position for them. It can be a very unsafe or a very vulnerable position for them. So we want to make sure that we are building rapport first and foremost with the client to create safety and trust, which allows us then to move into more ranges of motion or new positions where we can put them face down and allow them to let go, feel safe enough to, for us to do what we're doing, and then allow their body to respond on its own instead of lock up and protect itself.